Hello, Dr. Keysmith with you, Surgery Center of Oklahoma. Thank you for joining me. I've decided there are two types of buyers of healthcare in the United States. There are those who care what healthcare costs, and then there are those who don't. Ask the average person how much they pay for their gallbladder surgery. They'll likely scratch their head and not know, or they'll say, I paid my deductible plus 20% up to my maximum of $1,000. People typically don't know, and when they don't know, they really don't care. All they care about typically is, what was my deductible and copay? There's some people who don't care at all, and those are the folks that have very low deductibles and very low copays for their insurance. Then there are the people who care. The people who care what healthcare costs are the people who are paying for it themselves. I would make, I think, a pretty compelling case that the more people who care what healthcare costs, the less it will cost. If nobody cares what it costs, it's very likely going to be more expensive. And to the extent that third parties and intermediaries are involved in buying healthcare, healthcare is more expensive. By putting our prices online, we have made many friends of people who care what healthcare costs. The uninsured, Canadians, as I've said before, people actually from all over the world, the self-funded industry companies that pay for healthcare out of their operating revenue rather than participate in the insurance scan, and folks that have very, very high deductibles and healthcare savings accounts. I wanted to point this out, and I think in a future video blog, I'll talk about the two different types of sellers now that we've covered the two different types of buyers in the healthcare market. Thank you for joining me.